Hello, everyone. Mike Mosquito and my fabulous co-host, Maureen.
Nylin.
Back at you with another week-ending recap. We're here to bring you the latest and greatest in topics around our healthcare industry. Today, we're going to just chat about what's happening in our world. What's happening for you, what's happening in your family, in your professional life, what's happening with products, services, and solutions that may be affecting you, the patient, you, the consumer, you, the investor in this healthcare space. Welcome, Maureen.
Oh, Mike, man, we have had a fun week. I think we've had some really amazing guests that are going to be popping up in our upcoming podcast episodes, or we like to say vodcast, so you can both see us and hear us. So we've had a busy week. And we didn't get to do the pre-cap last week because also busy. Life, wow, this time of year gets really bad, doesn't it?
It does get bad. When you're closing out the year for your kids getting out of school and preparing for vacation time, it gets away from you. But you know what? People saw us a lot. We were out of state for a little bit, did a lot of road tripping for conferences. Conference season is winding down for just a little bit. But yeah, the podcast is live to keep bringing content. So I'm glad to be on the mic again.
Well, I'm glad that we're going to do the pre-cap for this week because, Mike, there was a story last week that honestly broke my heart. And I hope that this is unfounded. And again, all of these are allegations that have been alleged, but United Health Group took some hits in the media. And this was the week of the 21st. Becker's happened to put this out. It was originally published by The Guardian, but they talked about that there was a program in which United Health Group employees are situated throughout 2,200 nursing homes, and that essentially United Health Group incentivized for them not to send patients to the hospital when medically necessary. And by doing so, this would help to keep their costs down. And I told you this, when it comes to patients and then them being a business strategy, it always hurts my heart in a way that I think we can all relate to because we're all human beings.
Right.
So it gets a little worse though, because as the article goes on to say, they talked about not only did they intervene with potential admissions to the hospital, they would actually have numbers that they were allowed to do as far as admissions to the hospital. So
there was a bullseye.
Yeah, there's a bullseye. And so once you hit that number, then really you can't transfer any more patients to receive the care that they need. And it all ends with the pièce de résistance of there were patients that were encouraged to become do not resuscitate status. And so the nurse practitioners that worked within these nursing homes were incentivized to encourage their patients to not have any life-saving measures applied. So you've got heavy allegations here that you may need care and you can't get the care that you need. Meanwhile, there's a company that's benefiting directly from this. And so I'm going to leave it there because I would like your reaction to this. But honestly, I almost called you last week in a full-on ball that this, I hope, is not true, because we need to do better when it comes to healthcare, but we can do so much better than this easily.
You know my take on this. Where there's smoke, there's fire. You don't just come up with a news article like this out of nowhere. If you worked in healthcare, you know what the end of life costs so much more, and where payers don't want to pay for that. I could see where I could believe that. I could sit on a court. I could be in a jury box. And I could believe where they would skew a DNR for an elderly patient so that they wouldn't have to pay for them. I could believe that. I could get after what we've learned about our health system just in the past, call it 5 years, and the profits. You're paying big money for a publicly traded company. Their job is to make money at the end of the day. Nothing wrong with making money. I believe everyone should be able to make their dollar. but at the demise of our elderly and taking advantage of them so that you don't have to lose money,
Right.
that's where you cross the line. And I think that's where you get this animosity. That's why, you and I've toyed about how to take that other case on the podcast,
Hmm.
and
Hmm.
how would we have an honest opinion about care, denials, and all that comes with a payer performing
Yeah.
poorly for the patient, those people that paid for their premiums but don't
Yeah.
receive the care. And
Right.
so, how do you take on that mission when you hear stories like this on the back end? And they're believable. You can't say you would believe this. All of us have had to do a tangle and a dance with a payer. Um, but that is
Yeah.
a very sad state if you're getting our elderly people to change their DNR. What?
Yeah. Well, there
That's
were
that's
some internal emails that were revealed as part of this. And so it showed that, yeah, that they had budgets. And so therefore, that just was their overriding thought. It
mm,
wasn't that the patient needed assistance or care. And we've talked about it. Like you said, you referenced how far do we go into this? It's hard for me to understand because as a clinician, we have to carry liability insurance for ourselves. Now, nurses, fortunately, are usually covered within the health system's liability insurance, but providers specifically have to carry their own personal liability insurance. And it's very expensive and it is a burden for them to carry all of that. All that being said, they carry that because if they don't provide the care that they should have provided, this helps in the event that the patient is harmed in some fashion. I always beg the question, how is the insurance company that's denying care not also
hell
personally
liable.
liable for the outcome of the patient? So, all that to say, Mike, here's the 1-2 punch that I'm just going to give you this week. CEO of United Health Group, Andrew Witte, has decided to step down as CEO for personal reasons.
After how many months?
Well, no, this one's different. See, that one tripped me up too because I was thinking
Ah,
United Health Care, and of course, that was where the CEO was unfortunately shot, and I believe that was last December. I
yes.
don't remember, but um, that all that to say, this is United Health Group, so we're talking about that branch that manages the Medicare Advantage plans. So slightly
Ah,
different. He's resigning, personal reasons. Again, they didn't go on to say what that is, but what's really phenomenal is that they are asking, the board is being asked to support a $60 million compensation package for the incoming new CEO, who is yet to be named. But
six.
we're not sending patients that need the care to the hospital, but
Mm,
we're asking for a $60 million compensation package
for
for the
for one
incoming
individual, right? We're
for
we're not
one
talking about his
individual.
family and their ancestors.
Yeah.
We're talking about one individual today for $60 million for a publicly
Yeah.
traded company.
Yeah. Now, again,
Again,
I'm not saying $60 million is right or wrong. You and I both say, listen, people can make the money. And if people are willing to pay the money, by all means, go for it, get it. I think where I'm taking issue is trying to understand that if these allegations truly do exist, we are
right,
incentivizing people for the wrong things. Take
right.
the dollar figure aside, although it's a massive one. The incentivization is just way off its mark.
Yeah, and the incentives, excuse me, around that dollar are you should be taking care of the business of the people that are paying the premiums that pay your salary as well.
Yeah.
Because without those
Yeah.
premiums, you do not get that $60 million package. Um, but at what point do and yet again, now we have a mandate that you have to have insurance in this country.
Right.
So
Right.
you've got to pay a premium to somebody, or you're going to be in trouble. And when I pay it, I'm in trouble because I don't get the care.
Yeah.
Pretty bad, vicious cycle that we're under that publicly traded companies and CEOs can make that large of a dollar figure to take care of people, and people can still get denied. And there's a protocol. Right? We'll have that young lady on that told us about, you know, 3 times the charm. For those out there, we actually had a conversation about If you can write that letter once about denying my claim, you need to write it 3 times because that's the magic number for most payers to pay those claims. It's hearsay. It's not. We don't work for a payer, nor do we promote a payer, but that is from an actual employee within the payer world. And so, I mean, these practices are there for a reason because they still have targets to meet, financial targets to meet. They still have stockholders to answer to. So again, when you go to your next doctor's appointment and your insurance is supposed to cover and you get that denied claim, just remember somebody's getting paid off of that money.
Yeah.
One
Well,
way
and
or the
think about
other.
this too. We have heard rumblings that the government is looking to, what's the word that I'm looking? Yeah, cut their way out of the Medicare game and allow that to become privatized. And so Medicare would essentially dissolve and everything would become Medicare Advantage.
Everything. What
This
do you think
can't
your
be the
care setting would
example
look
that we
like
want to
after that?
lead with.
Yeah, that's not the one you want to lead with right there. That's that
No.
privatization is going to lead to more bad behavior. Let's just put it
Yeah.
that way.
Yeah.
More bad behavior. You
Hopefully,
think
again, hopefully this is wrong. That's how I'm going to sleep tonight because otherwise, I don't know that I will sleep well knowing that we are failing each other as human beings. But
and I'll speak out of both sides of my mouth. While we say it leads to bad behavior, maybe it will bring some good behavior about because there won't be a conglomerate, right, of the big four, big three that are just sucking down all this bad behavior that they're known for. And maybe privatization will pull some of that back if there's competition to say, hey, we're going to take care of the patients. Yes, we're going to be fair and just in paying for claims while there'll be an investigation to make sure there's not fraud and abuse. We'll make sure that the patient is taken care of. And ultimately, that's what insurance is there for you to be taken care of and provided care when you need it,
right.
right? And so it's you hit a hot button today with that
I
one
know.
because
I know.
unfortunately they can't stay out of the news. They can't seem to get out of their own way for making headlines. Either group, it doesn't matter whether it's um, the group side or the payer side of the house. It doesn't matter which side of the house. They're still getting the optics of bad behavior within the health system. So
Yeah. Well,
I hope that we can do better. You know, the underserved, they're still not being addressed because they need care. Our underserved population is growing. It's going to continue to grow. Our age disparity is getting larger. There are more people that are hitting that
absolutely.
threshold to need more care. And so now what happens? We're producing less doctors and nurses. More people need care. What happens in this next scenario? The article today I saw today about Google getting in with their new wearables and putting those on patients to help them track and monitor their health care. That's only for a certain population. As you're
Yeah.
not talking
Yeah.
about, middle to upper class can afford that. Those that are barely paying their light bill, guess what they're not worried about? A wearable that needs
Right.
broadband connectivity in their home.
Right. Yeah. I think it just continues to show the obvious gap that we have where we're going to have those that we're trying to move to predictive medicine, which is
Mm-hmm.
where we want to be, right? We want people to have good health for themselves personally. Who doesn't want to have great health? It's lower cost. It's that's wonderful. I mean, everybody's winning, right? Except for those that don't have that as a choice. And so I've been, you take me back many, many years ago, and sometimes in my mind it doesn't feel like it was that long ago. We weren't living in a great situation. Times were not easy.
Right.
And I learned a lot through that. But you know what I wasn't interested in at that point in time? I, like you, probably just said I was worried about the light bill. I was not worried about a Garmin watch that was going to tell me that I wasn't sleeping well. Guess what? I already knew I wasn't sleeping well
Right.
because I was worried about not paying my light bill.
That's it. And so you got to think about when we talk about the analytics that are gathered behind wearing these watches and better care and better health, we go back to bad data because those watches were only worn by a certain population group that could afford them. So
Yeah.
when you can say, oh, we've got better predictive analytics around obesity and heart disease around a certain population that has the money to be able to be in part of that study, you're not giving it for free and providing broadband to those underserved population areas. And so you're not gathering that data. So the data is still bad. Even when we talked about advanced telemetry in the home and gathering data for those patients so we can treat them better, you're still not gathering because they don't have access to the tools that provide better care. Unfortunately, we're
Yeah.
back to square one if we don't watch it. I'm hoping. I had a nice meeting with a group, and they provide connectivity in the community, and they wanted to know from a group of executives how to do it be better. And I think we all collectively said, help us outside the perimeter of the main cities that you want to service and get your main dollar from.
Yes.
Get into
Yes.
the rural community. You're in
Yeah.
you're in Iowa, right?
Yeah.
You get to see
Yeah.
farmland around you.
Yeah, absolutely. I don't have to go very far, just in my backyard, and there it is. So I immediately imagined, Mike, as soon as you started talking about those areas that are underserved, I remembered a story about the one ambulance serving this entire community. And I
Yes.
think, okay, so here you've got this person that's spend a lot of money to have the watch that tells them whether or not they're in AFib, and that's going to help them to know when they need to go to the hospital. But now you don't even have a way to
To
get
get
to the
there.
hospital.
That is South Georgia.
Yeah.
That's a reality. That broke my heart. That was a lunch and learn for our bringing up two of our mayors of small towns in southern Georgia to tell their healthcare story. I went home very disturbed that night because to hear a mayor grieve for
Yeah.
his people in his town, to have at least a doctors that go to school for this long don't want to go live in a small town in rural Georgia where there's only one ambulance between the whole town.
Hmm.
So how do you get care? How do you take care of these people? And so that's the reality of our world of healthcare today. So for those out there that are listening and you want to do better, help the internet providers and the providers of care in your community be better, do better. Show them a path for getting in their community, providing for those that don't have a way to get to the hospital, that don't have a mechanism in their home for providing for assistance, direction, and better care. Because ultimately, if we're in this game of healthcare, we're not building cars or the next AI chatbot or the next rocket. If you're in this game of healthcare, it's for life. It is for developing the best solutions for the people that can afford and for those that can't afford the solutions. How do we get the right
Well,
care in the right place?
and our friend John Manis just said this at Texas Regionals. He said, we have got to stop looking at this from the lens of a service provider and start looking at this from the lens of a customer. Because until we change that, we're asking our patients to come to us in a way that's convenient to us, and we are not going to them.
That's 100% correct. Well, for you out there, that's our quick 2 segments for the weekend recap. We cover a lot in this 20 minutes. We hope it's a little provocative, a little thought leading for you to be able to take to your groups and have a conversation. Hopefully, it'll change the narrative for you and the products, services, and solutions and patients you serve. We here at The Buzz think that you are important to us because these stories are for you. So, Maureen and I thank you for listening. And until next time, like and subscribe and keep buzzing.